Hello, everyone. My name is Dr. Ronak Patel. I'm with the Harvard Humanitarian Initiative, also known as HHI, and I'm joined here by Dr. Anshu Sharma from the NGO Seeds India, which he co-founded and now leads. We're very excited to be doing this webinar series and really grateful for your overwhelming support. And so before we get started in today's session, we just want to take a couple of minutes to introduce the series. As you can see from all the logos below you here, this is a collaboration between HHI,
Hello,
the NGO
everyone.
Seeds
My name
India,
is Dr. Ronak
as
Patel.
well as
I'm with the Harvard Humanitarian.
the Australia Pacific Security College at the Australian National University. Anshu?
Thank you, Ronak. As you all know, COVID-19 has had a devastating effect on cities across the globe. I think all of us are impacted in some way or the other. But this is not the only crisis cities face. The climate emergency has fueled fires, it has worsened floods, it is increasing heat. Where I'm sitting right now, back to back, we've seen two cyclones in the last couple of weeks. Armed conflict and urban violence are also on the increase, while the impacts of rapid onset disasters threaten thousands of rapidly urbanizing and yet poorly prepared towns and cities, definitely across Asia and the Pacific in particular. The need to build resilience has been a prominent approach for over 10 years, maybe even more. But what does resilience mean in these times through an era of pandemics, climate change, and rapid urbanization?
So this online series will present 4 talks by experts who explore what those challenges are, where the opportunities lie, but most importantly, what each of us can do to confront this changed world we now live in. Each talk will be followed by some questions by the interviewer and a live Q&A session from you in the audience. So please start writing in your questions into the chat box as you have them, and then the interviewer can bring them up. Borrowing from a popular BBC radio format called Chain Reaction, the interviewer for each webinar will become the presenter and interviewee for the next. So the second in this series, on July 2nd, we'll see Dr. Sharma here present on the informal market crash occurring in low and middle income cities caused by the pandemic and its aftermath, and where the opportunities lie for building resilience. Professor David Sanderson of the University of New South Wales will then do the third webinar on August 6th. He'll be focusing on the role that corruption plays in fueling disasters and pragmatic options for protecting the most vulnerable.
And finally, Professor Meg Keane from the Australia Pacific Security College at the Australian National University will present the final webinar on September the 3rd on how interventions during urban disasters represent great opportunities for innovations in developing the chronically vulnerable people across the cities. Please keep an eye on the timing of each webinar. These will vary considerably. So today, this is early morning for Ronak and it's the evening for me. And thanks a lot for our friends in Australia who stayed up late to join us today. But these timings will keep changing depending on the speakers and the time zones that they are in. So without further ado, let's get started. Let me remind you to please start writing in your questions that Dr. Patel is answering and speaking. So I will be following what you're posting on the chat down here. And I will keep bringing them up to today's presenter as we go. Dr. Patel is, as we know, the Director of Urbanization and Resilience Program at the Harvard Humanitarian Initiative, and he will be discussing how cities are epicenters of a planetary health crisis presented by COVID-19. And he'll tell us what a planetary health crisis really means. Ronak?
Thank you, Anshu. So I want to just briefly take about 15 minutes to discuss these topics, so then we can have a back and forth. Now, planetary health may be unfamiliar to some of you, but very simply, it describes how human health is dependent on the health of the ecosystems that sustain it. Things like our freshwater systems, our marine systems, air, things in our biological, ecological environment, but now that interact with our built environment. I will give you 4 pathways on how I see this happening, and then 4 priorities for us to respond. Now, because you're attending this, you already know that the novel SARS coronavirus 2 has shown that cities can propel a pandemic, right? The first cases were in urban hubs connected to travel from Wuhan, a city, and the spikes in the following countries were often in the dense cities. Now, despite the low case counts, the threat for rapidly growing cities with large swaths of urban informal settlements that concentrate the risks for disease spread, with reduced ability to contain and manage given overburdened and underdeveloped healthcare systems, still remain the most concerning places going forward, I believe. But in addition to these urban features, I think the planetary health dimensions have been under-discussed. And while we're still trying to figure out the granular details on how various factors contribute to mortality from COVID-19, there are a few that are related to our ecosystems that are becoming clear. And so in short, I am proposing that our mortality from this pandemic, and very importantly, future pandemics, would be far lower if we had better planetary health. Now, mere months before this pandemic, officials in Dr. Sharma's city, where he lives, were imploring him and other residents to stay indoors, but for a very different hazard, air pollution, right? Air pollution has significantly increased in many cities while it's been improving in others. But during this pandemic, air pollution contributes to greater susceptibility to and severity of COVID-19. Data from the previous SARS outbreak in 2002 in China showed that living in areas with air pollution or higher rates of air pollution carried an 84% greater risk of dying from SARS compared to those living in lower areas of air pollution. Recent data, initial data from the US, is showing a similar increase, maybe 15%, but that equates to air pollution being 20 times more deadly for COVID-19 than it is for all other causes of mortality. Given that rapidly growing cities continue to have worsening air quality, they will suffer disproportionately greater mortality from this current pandemic and others that have to do with respiratory illness. Another pathway, in addition to air pollution, our cities absorb far greater amounts of energy from the sun than our rural areas and have a decreased ability to transpire that heat because of reduced green spaces. Now that's something called urban heat island effects, which many of you probably know. These are unevenly distributed though, right? You can imagine dense settlements without green spaces where the urban poor reside tend to feel that effect more. They also have reduced coping capacity for it, right? And high indoor heat specifically can contribute to worsening chronic respiratory conditions that may further exacerbate COVID-19, the severity of it at least. Climate change and that population density has been shown to largely explain the magnitude of those urban heat island effects. And the Center for Research and Epidemiology of Disasters estimates that 25% of disaster deaths last year were related to extreme temperatures. So as our climate changes, the projected temperature increases on our planet that we are observing will be far more realized in these cities, leaving the urban residents at greater risk for this, and again, future outbreaks of respiratory disease. Now, one of the most obvious ecosystems, along with urban development challenges, has to do with water, right? Deficits in the quality and quantity of water that our citizens receive. Many of the urban poor and informal settlements of these cities often share a tap, sometimes up to 50 per tap, right? And the quality and quantity of that water is insufficient often to just meet basic needs. When hand washing and social distancing are critical, that's the message we and public health officials like myself have been giving out, putting these urban populations in a very dangerous position if they can't meet that need. Cities in sub-Saharan Africa are the most impacted. 22% of households often only have piped water there. And a recent survey by the Population Council in Nairobi showed that 25% of urban slum residents said that lack of access to clean water, sufficient amounts of it at least, were the major impediment to hand hygiene. And so our worsening depletion of groundwater, fresh groundwater sources, will continue to exacerbate water scarcity. The majority of the world's freshwater aquifer is actually under stress now. And of the 2 billion people living under water stress, it's projected to grow up to 6 billion in 30 years. Again, that effect will be most pronounced in our urban centers, specifically impacting the urban poor and specifically handicapping our ability to contain this, and again, future pandemics. Finally, food production is critical to the idea of planetary health, right? Agriculture alone accounts for 90% of our groundwater use. But urban diets, processed foods, increasing meat consumption, all of those have contributed to a very poor management of this vital resource just to feed a growing planet. This food insecurity is made worse by climate change. Again, a recurring thing. Droughts, water salinity make arable land less productive, putting insecure populations under further stress. The most pressing concern, as we've heard in a lot of the news, among vulnerable populations has been less so the coronavirus, but hunger. You know, the same population survey that in Nairobi slums found that almost 70% said that in the last 2 weeks, they had gone without a meal. 3/4 said their biggest unmet need was food. And the United Nations has already warned of a global famine of biblical proportions, which sounds like hyperbole. But it's easy to understand when you understand that these are very fragile livelihoods, and some of the knee-jerk reactions and the rapid nature of the shutdowns and lockdowns have impacted them greatly. So I'll pause there as to see if Dr. Sharma, this resonates with anything you've seen and experienced in your work.
It absolutely does, Ronak. In fact, while we've been reeling with this pandemic and its impacts, this is, you know, our third month in a lockdown. In many ways, the lockdown is no lesser of a disaster for us and so many people around us than the pandemic itself. And as I briefly mentioned, I spoke about the two cyclones. In fact, had it been an hour earlier, I would have turned this camera around and showed you the skies in Delhi. It was drizzling because remnants of the cyclone Nisarga that hit Mumbai yesterday are just passing by our area, central India. But then in our work in recent weeks, even during this lockdown, there have been two cyclones. The floods are around the corner. The monsoon has already hit India. There is a heat wave in parts of the country. There is a locust attack happening. There's so much going on. And there are so many moving parts. So I really wonder if you have any thoughts on how and what this means for our priorities in going forward, Ronak.
Yeah, that's a good segue into the priorities. So, you bring up a very important point, and it actually speaks to one of the first priority I'll mention, almost as if we had planned this. But people have talked about this, right? The idea of cascading hazards or layered hazards and cumulative hazards, right? The title of this webinar series is Resilience at Risk for a reason, right? We've been talking about resilience, but it's hard to build resilience when you're constantly being assaulted by these stressors. But I would argue that it's a little more complex than just talking about it as cumulative or cascading or layered. These risks aren't just additive, they're multiplicative. These risks interact in various ways, just like we've seen with these planetary health dimensions and climate change, to have specific types of impacts on vulnerable populations in various contexts, right? Understanding how those risks interact with each other to result in those impacts is critical for us to address them. Similarly with resilience, the protective mechanisms, the resilience mechanisms we employ interact with one another. A social protection program along with another food program, those things have different effects on different populations based on which risks you're addressing. And so I think we need to interrogate that complexity. We can't shy away from it. And that is going to help us figure out these models and risk scenarios that will let us make the right investment decisions, right? Obviously, you could say, well, you just said there are these very basic deficits. Wouldn't just addressing many of those move us towards resilience? And yes, they would. I'm not saying this is an either or. I'm just saying that when you have limited resources and you're trying to figure out which levers to pull and push, really engaging that complexity and figuring out these interactive um, mechanisms between risks scenarios and resilience mechanisms is important for us to make the right decisions and investments. Similarly, another priority is also something we've talked about, right? A greater emphasis on local contextualized response. And now, Anshu, you know this well from your work, and I bet you'll talk about it at the next webinar, but using hyper-local supply chains has been critical for you, right? This decentralized planning, localized data, decentralized implementation, all of those things are important. The data gathering we get from these populations, even some of our research into urban population targeting showed that vulnerable populations that are able to self-identify and self-target was sometimes the most efficient and accurate way of identifying the most vulnerable, right? So using those methods is critical, and I think it's just made more highlighted by this current pandemic, especially during a shutdown or a lockdown. As a corollary to this, right, inclusive forms of decision-making, in effect, inclusive governance, is another priority, right? Yet again, made more pertinent by this current pandemic. And it moves us beyond just listing, right? People have talked about the lockdown that you just mentioned in India and the impact that it had on migrant workers. And so imagine that lockdown having migrant workers in mind. But take it a step further, instead of just planning a lockdown with migrant workers in mind, but planning a lockdown with migrant workers, having them in that decision-making capacity would have been far more better at us figuring out how to make sure that they're protected and reduce all of those other impacts that you just said have been sometimes worse than the coronavirus itself, right? And finally, similar to being mindful about the planetary health dimensions, and I want to say this as a public health professional, it seems often what you've heard from decision makers and even public health professionals is that You're not allowed to die of COVID-19, but it's okay if you die of everything else and all the other consequences because this seems to take priority. And while that may be appropriate in certain contexts, it is not in others, right? We know, a lot of the audience knows, that health is a function of physical and social determinants. And so for the urban poor, the collapse of livelihoods and the informal markets that you'll talk about next month leads to various impacts that we don't even measure, right? There are going to be huge impacts in mental health, in intermittent partner violence, in losses to education. All of that will have tremendous impacts now and long term that will carry significant morbidity and mortality implications. Again, going back to my first thought, we need models and decision-making processes that understand these, that engage that multidisciplinary nature and that complexity. Otherwise, I think we end up making somewhat poor, knee-jerk, or repetitively bad decisions, specifically as it relates to the most vulnerable. I'll stop there and maybe we have some questions from the audience. And Anshu, I don't know if you have any thoughts on what I've just said.
No, I think thank you. This is great, Ronak. Very succinct, but very organized thoughts. So many thought-provoking suggestions you have, especially on the way forward. I think that's really critical. That's a takeaway for us from here. I'm keeping an eye on the chat box. There are greetings coming to us from all over the world. I'll in a moment tell you if we have extra time on where all people have tuned in from. But there's a question here. Rajshri Kotarkar is asking us what we understand that most of the city planning models are economy centric or they're economic in nature. And our current concerns are more than just economic. So, what are your thoughts on developing newer models of urban planning around climate and climate related concerns? Ronak, any thoughts on this?
Yeah, this is a great question. It is a Pandora's box, and we could have a whole day conversation about this as a community, right? And it hits it right on the head. When we think about these decisions on urban planning and urban development, and I would argue even many of the consulting firms that do all of these risk scenarios in urban planning, urban development, the output measures are GDP growth, investment decisions for this type of urban planning and real estate development. Oftentimes they ignore these other metrics that we're talking about. And the whole reason I wanted to talk about planetary health is that our economies, the growth in our economies, have been fed by our ecosystems, right? Exploiting those natural resources have allowed our economies to flourish. They've indeed allowed humanity to flourish, right? Great improvements in other things like public health and poverty alleviation. They've given rise to our urban centers, right? A city is not just the footprint of its municipal boundary. It sucks in resources, vast amounts of resources. A dam in a distant place for electricity, timber from halfway around the world. All of those things fuel that city growth. And taking those things into account into a more holistic equation of not just urban planning, but just urban development and our own goals as a society is critical. Specifically urban planning, though, we do need better models, right? There are various ways of understanding how various types of urban growth reduce ecosystem loss, induce ecosystem loss. And so there's certain percentages, they're all estimates. So 1 square kilometer of this type of growth leads to an X percentage of ecosystem loss, either immediately surrounding or even further away. But we need to have better versions of those, and that needs to be part of the equation in those decisions that are made. So it's an excellent question. Again, a multidisciplinary approach is required there.
Thanks. And I think, as you say, it opens a Pandora's box. We could go on about it, but we need to move. And the next question I'm going to take is from Tom Corselis, and he's talking about mitigating transmission and the impacts of our lockdown. We have the opportunity to cross-fertilize local experience and collate into a thing, a replicable approach of options for selection and adaptation to local circumstances, and options for shelter and for settlements over space and time. If each option takes in a few percentile points off negative impacts, the multiplications may also work the other way and increase a socially responsive R value below 1. As a species, we are again challenged to mutate or adapt to a changing environment faster than our viral opposition. Share what works, and I think that's a great comment Tom is making. It goes into a bit of the science, but then in the end, Ronak, he's asking you what works. Any good examples?
Yeah. So first I'll address the comment. It's a great way to frame it, if I followed it correctly. In that it's requiring us to make decision based on the amount and rapidity, specifically the rapidity of change that we observe, right? The fact that we're having to take into account so many moving pieces and uncertainty in those moving pieces from climate change and migration and the growth of inequality makes us have to figure out new ways of that type of decision making, like he just mentioned, right? And so taking simple steps, like he mentioned, for even if it's a small amount, that scale, given the populations that we're talking about, is immense, right? An example that goes back to one of the priorities I'll take is for making sure that there were enough livelihoods being met and food being delivered to the urban poor in Kampala city, right? 70% of Kampala is informal settlement. And so during a shutdown and lockdown, that has a great impact on the livelihoods where most of those people get their food from local market sellers or streets vendors, right? In addition to being able to just get those foods available to them. So they had a very proactive program that helped merge and include a lot of these vendors that were in the street with the needs of these populations, creating, delivery mechanisms through bicycles that created livelihoods, an app and a telephone system for them to place their orders, so that you still had these hyper local supply chains that could meet those needs. Now that doesn't need to be just occurring during a pandemic or a shutdown, right? That can be something that can be scaled at any time to address a lot of complications in meeting people's needs, right? Things like that are those types of avenues that I think we need to explore and see how we can support. And I'm hoping, again, this is another hope, that as we exchange ideas and success from this experience, that we'll learn a lot what we can do.
Great, thanks. And we have another one. Ronak, the questions are coming really fast at you. There's one around how urban governance and finance should be restructured to respond to these concerns, but I'll move to another one, which kind of, takes an overarching approach to this thought. And Thomas Nordberg is asking, how do we achieve this desired multidisciplinarity in research, design, modeling, and evaluation? Ronak?
So I have a couple thoughts on that. One is, as a researcher who goes after funding, I've been encouraged by many of the new research mechanisms, specifically in the humanitarian space, that require a multidisciplinary team, right? Many of them will say you need a certain type of practitioner and an academic partner, but they'll even go beyond that. I've been now looking at various grant proposals or requests for proposals that say you need a social scientist as well as a medical scientist and XYZ. That's one way to make sure that's included in the research that we do, right? So that when you have these big scale problems, that you're bringing those resources to bear rather than just one type of silo discipline or developing that area that you already have an expertise in. And I've already seen that when I start to collaborate and all of the new things that others teach me and I learn about, that has me thinking different thoughts, right? And so even when I go into a research project, if I had one idea or even an ABC idea, I end up with an XYZ idea because of my colleagues. They're able to present new ideas and new ways of thinking that we can come up with something innovative. The second part of that is a lot harder, right? Putting that into research, I think, is much easier because I think a lot of us are inclined to do that, interested by it, specifically now, maybe more so than in the past. How to get that into decision making is much harder, right? There's that whole banging your head against the wall of, we know some of this already, proving it through research is not really what we need to do. Maybe some operational research on how we can implement those types of multidisciplinary approaches, or sway those decision makers with what's important to them, and using those in our research outcome metrics is critical to have that impact. But we need to bridge that somehow.
Great, thanks. I'm glad you were so brief in your initial presentation, Ronak. We have 20 questions and comments queued up. I'll move to Lloyd Rego, who's asking, in fact, he's pointing out that we have seen quite a bit of reductions in emissions and changed lifestyles that are now getting more local. But how do we move from here to make this more dramatic? What can be done to speed it up, Ronak?
Wait, so is it, we've already seen changes in the life cycle of
Yeah, so if I get it right, it's more around how do we see a more dramatic shift towards, seeing simpler lifestyles and lower consumption patterns. How do we make cities more sustainable, but not incrementally, but how can we leapfrog to that level?
Yeah. Another Pandora's box, right? So that's a hard question, and it's been interesting seeing some op-eds pop up talking about this, saying, "Listen, we've been saying we needed radical change to address this climate crisis," and so many people on various sides of the aisle have been saying that's not possible, that's too hard, you're going to cause too much disruption and pain. And when a pandemic hit, people did it. People were able to make drastic changes, even at least temporarily. There have been people that have been able to, whole cities, try to rearrange their modes of living around it. Now, again, that's been stressful. I myself have been homeschooling two girls while trying to go to work and do this research with you. It's been a strain. It's not been easy to do those kinds of things, but we've had to when we want to address a very urgent crisis. I would say the planetary health crisis, the climate crisis are equally urgent. And I think that's what the questioner is asking. How do we make sure that something like this can be leveraged to show people that we can still do that and make that kind of change? I think it's still hard though, until you make it easy for people to do. It's just hard on a day-to-day basis for us to do that if it's not just easy for us to do, because it is hard, right? People have lives, they have their way of living, they have their social support systems, they have their livelihood. Structural things can't change that easily. There have been these thoughts about and I've seen now just two or three op-eds talking about the 15-minute city, the Paris idea that you could have everything you need within 15 minutes, your job, your market, your local church, or whatever social support you use, your community is there, so that you're not traveling further distances. And those op-eds have tried to make the argument that perhaps it's good for social distancing. I question that. I'm not sure that that is enough to actually mitigate the transmissibility of certain viruses, because you still have probably enough travel within a dense city not to have much of an impact. But the question's out. I mean, we would need to model those kinds of things. But I do know that that would change some of those things that the questioner is asking, right? That alone would reduce the amount of car use in a city drastically, right? The amount that we need, to put those investments in large, wide-ranging public transportation systems, because people will have a lot of those things within 15 minutes. There was some really good research, preliminary research again, out of Stanford, looking at the reduction in air pollution just from the shutdown and how that might have saved tens of thousands of lives in China alone, just because of the reduced, CO2 emissions. Now, that doesn't balance out all of the other problems that we're seeing, right? It doesn't balance out all of the cost and consequences, specifically for the urban poor, that we just spent the last 20 minutes talking about. But it still makes that equation something we can have more rigor in for us to make those decisions.
So, Ronak, we have close to 100 comments. We'll try to do as good a job of this as we can. Rohit Negi is asking about public transport going forward. Going forward with the viral risks, especially informal transit mechanisms whose business models depend on overcrowding. Any thoughts on urban transport?
I mean, unfortunately, I'm not an expert in this, but my two cents is it'll be hard to intervene on that. People need to get from point A to point B. And if your livelihood and your daily wage, if you're an informal worker, is dependent on that, you will do what it takes. You'll take that risk. And you might say, I'm young and healthy, so I can take that risk. Our preschool for my daughter just opened up. And so some of our friends aren't willing to take that risk. And we are, because we just think it's a certain amount of risk, we're willing to take it. Now imagine if it was a different disease with a different susceptibility for children, we wouldn't do that. So everybody's going to make those types of risk decisions. We just don't want to make it a systematic thing where the urban poor always have to make the bad decision, always have to bear the burden of that. And I think that's what he's really asking, is that how do you make sure that their ability to have public transportation when they can afford the other types that may have social distancing wouldn't do that? And that goes back to larger decisions on how you run a city, how you fund those public transportation systems, and whether you have different pay schemes, or do you make it fully free? those are things beyond my area of expertise. But he's right in that you have to structure it in a way that they're not forced to make that decision only because they're poor. Their risk calculation should be the same as someone who has the wealth to engage in either private car travel or take that more formal form of public transportation. That's for sure. Again, that's an advocacy issue and a modeling, the budget for public transportation issue.
Yeah. And this is something we will also talk about in the next webinar in this series, because, as we all know, the poor do not have the luxury to work from home. And it is going to be a very challenging question around levels of acceptable risk. As Ronak said, those who are more desperate will have a much higher level of acceptable risk. And these higher levels will have implications for all of us, the entire cities, not just for these people alone. Moving ahead, Shantan Lakis, I hope I'm pronouncing the name right, asks how can we turn this pandemic into an opportunity for building urban resilience, especially in cities that have urban slums and informal settlements. So, what can humanitarian development organizations include in the response to contribute to more resilient cities, especially the most vulnerable groups within these, Ronak?
So my answer to this is somewhat cynical, and it goes back to an answer it's a copied answer from a talk I heard from the deputy director at the WHO now almost 15 years ago. It was at the Rockefeller Foundation had a Bellagio summit in 2006 when they wanted to reorient their program towards urbanization. And I was sitting in a small group with this deputy director who's talking about urbanization and urban health, and that was his specific topic. And the comment was that pandemic preparedness, global health security for developed nations, the implied losses to their economies and the disruption to their economies is the speedboat to urban slum public health development. And unfortunately, highlighting the risk that informal settlements pose to spreading a pandemic, fueling a pandemic, nurturing a pandemic, just because we wouldn't have the surveillance mechanisms to be able to detect and contain, would be the way that you could convince those economies to invest in that, because it's just money. It's not that we don't know what to do. Public health doesn't need a brand new innovation in those terms. We need some operational research, but we know vaccines work. We know keeping water clean works. We know having sanitation works. We know primary care works. And we know how to implement those. We've done it successfully over and over again. What we need is the funding to be able to do those and have them sustained. And that's where that loss is, right? Where did that tranche of funding come from? And so there might be some room in the questionnaire asking, how do we make sure we do the right programs for community health workers or traditional birth attendants so that we have the right metrics on infant mortality, or make sure that we do it the most efficiently? That's true. There's a lot of operational research we can do, but a lot of the basics of public health we knew from the 1970s, Alma Ata conference, right, on how you do primary care and global health. Now we need to figure out how we implement that and make decision makers put the funding behind it. And that's where I think that cynical response and maybe leveraging this pandemic and calculating those losses for developed economies will at least get them interested in investing. Now, my fear is the opposite will happen, right? Currently, we have a lot of global leaders that in the time of this type of threat have been looking inward. And when we've needed global cooperation, it seems like we've been seeing a lot of the opposite, unfortunately. I'm going to close these blinds here because it looks like it's causing a reflection.
We're good, but this is also great. So now, Richa Joshi Pandey asks, how do you include migrants at the time of announcing lockdowns, and how could this be a planned process in an inclusive way? I think a lot of our questions are moving towards the lockdowns more than the pandemic itself in the urban context. Ronak?
Yeah, I mean, if we want to go down that, we can, but I know, Anshu, you're going to talk so much more about this in the next session, which I'm sure will be well attended. So again, in terms of just including them in the decision making, it's not like saying, hey, let's take a migrant off the street and have you now come into the planning committee at the central government. They needed to be included from the beginning. And there are advocacy groups that do this, right? It may be just a representative group. Very powerfully, and people know this, Slum Dwellers International and Federation has done great work in doing that themselves, right? Enumerating, empowering, and making their voices felt in the decisions that various municipalities make. And so that can happen at the same level at national plans and planning, right? But it requires leadership, and it requires leadership to take that step because it has to be something of drawing in. There's a lot of the let us be in and push into that type of decision making, but it requires progressive leadership. And again, that's, I think, what we've seen during this pandemic. If you had looked at the cities that you thought might have been the most able to prepare and deal with a pandemic, you wouldn't have said that New York would have failed so spectacularly, right? You wouldn't have said possibly London would have the cases it would have, right? But they did. Leadership matters, right? National and local, it matters. And so we can have the best preparedness programs. You and I work on these resilience scores, and we made some ourselves and resilience programs. You can build those things all you want and have them at the ready. And you can build those preparedness plans. But if they're not executed by the right leader at the right time in the right way, it doesn't work, right? So leadership is instrumental to this.
Here's an interesting one for you, Ronak. Krishna Koirala asks, what are the priorities for the unorganized cities with poor health facilities to reduce the effect of the alarming situation of the disease in the lockdown? So she's bringing both of these together. And this is actually the point where we meet, where health and the built environment meet, where we believe that a lot of these health problems are rooted somewhere in the built environment. And I really like the way she's really spelled out unorganized cities with poor health facilities.
Okay. So I will push back on the idea that they're unorganized. I would call them organized, but organized different, right? Some cities, again, I'm stealing this because it was such a brilliant quote. Some cities are planned in the back room of smoke-filled offices, and some cities are planned footstep to footstep, corner to corner on the street, but they're still planned. They're planned by the people there, right? Yes, it doesn't fit into an organized urban plan, and it actually is a detriment and impediment to that type of progressive urban planning, but they still are there. So figuring out where that happens, how that happens, and using that as a way to intervene while we wait for this progressive, overarching, inclusive urban planning to take place is where it could happen. And again, there are examples of that. Again, Slum Dwellers International has done great work on that. When it comes to that question specifically about health, because of the unorganized health, again, I would say from my work, I've seen so many health practitioners and health infrastructure, a vast array of health infrastructure in these informal settlements that have a lot of this risk to disease. But that health infrastructure comes in various forms, right? It comes in the forms of pharmacy shops. A lot of these pharmacy shops are unlicensed, untrained, but they give out daily medication for things like hypertension and diabetes. Those chronic diseases that the questioner is asking, what about those that get undermined during a pandemic? Those are still often the point of care for people. So somehow bringing them into some training process, some certification process to standardize and improve that practice might be the best way to ensure that an already used resource that is already prevalent in these populations could be the service point for a lot of primary care. You know, that would be a great research project to strive to employ, right? Because when we found in our research was that when we tried to survey many of these, oftentimes the care they were providing didn't meet any standard of practice. You know, out of 100 pharmacy shop providers in an informal settlement in Pakistan, 99% had a treatment for WHO, for TB that had nothing to do with the WHO recommendation. But it's not that they don't want to, right? They can easily, if they're not predatory, say that, listen, I would gladly do the right thing because it still helps my business, and bring that into a process and integrate them into some public health or primary care delivery model. So we need to look at some of those novel methods. Another is community health workers, which has been done often over again, mostly in rural areas to reach some of those hard to reach populations. But urban slum residents are the same, right? They require that type of mobile healthcare delivery oftentimes just to meet that need. And again, bringing them into that type of service model is critical. But I would argue that even though they're organized differently, there's a lot of healthcare infrastructure that can be leveraged and improved to mitigate the impact of a lot of that loss to primary care from a shutdown or a lockdown, as well as try to improve our response to the next pandemic. You know, those service points, either the pharmacy shops or the community health workers, become trusted sources of information, sometimes far more trusted than national leaders or a lot of the misinformation that you can see happening. So they may be critical, actually, to getting the right messages out. And we've learned from previous pandemics, specifically Ebola, that trust in the messaging is critical to making sure that you can contain a pandemic.
So I have a very quick follow-up question, although we'll move on because they're just streaming in very, very fast. But Ronak, right now, on this question, there is this point around the unorganized, and so far in our policy frameworks and the way we implement things and the way we run our cities, there's a very stark dividing line. Below this is unorganized, above this is organized, this is informal, this is formal, this is illegal, this is legal. So based on what you talk about, the pharmacies, and there's many other, equivalents that we can find in other trades. Is it possible to push for a regime which, though it maintains a basic minimum standard at the lower end, but it tries to bring a lot of this up here? So with certain cautions, built in, with certain factors included, so that things don't really go out of control. But how can you address this at a policy level to bring in more of this unorganized, informal into our formal systems?
Yeah, that's hard because the pushback on the idea that I just presented is, where did that capacity come from, right? So the normal way you see that is either through trade organizations or professional organizations that do that themselves, right? They self-regulate, they have certification processes, they have methods of improving that education and training when necessary. Just like for physicians, as soon as something like coronavirus happens, their education modules to come out, we have to make sure that we understand the right protocols and the most up-to-date protocols to make sure that we're doing the right thing and raise our standard of care and that it's more universal. So taking something like those pharmacy shops, or even if it was first responders, that are haphazard or informal, bringing them into that type of formalized structure or standardized methodology or improving their training capacity does require possibly that, either these trade federations or professional groups, or requires something at a public source, right? It has to be a regulatory body at a municipal, regional, or even national level that does that. And again, that requires some capacity, either to actually implement it or even enforce it, right? So that, say you had a pharmacy shop that is now integrated into the primary healthcare system, when you see one that isn't, how do you find them? How do you go after them? Especially when they're so numerous, right? And so again, it does come down to money and resources and funding to be able to do that. But if there were ways for organizations to do that themselves and self-regulate, that might be one. And I think, Anshu, you're going to talk about some of this when you talk about sourcing goods and services for these informal vendors, right? Next time.
Great. Yeah, no, that's useful. I'm going to club two questions now. There's one from Azmi Nimji talking about, something you touched upon, Ronak, the multidimensional and the socioeconomic impacts that, are happening layered with other incidents, which are the naturally triggered disasters we spoke about. And Nimji is asking, what type of models can we develop that will address these risks? I'm combining this with a question from Mihir Joshi, who's asking, which tools do we need to look into, and what role do you see for communities in this? So this is the modeling and tools, space, and Mihir adds an element that how much of this will be owned by communities, Rona?
Yeah, no, it's a great question. I'm a nerd, I'm a research nerd. And so I love this idea of looking into ideas of assessment tools and modeling tools and what kind of data you need and how representative is that data, how true is that data, and whether you end up with the right models to make the right decisions. Because oftentimes, especially in my field, I often see, and I've done this myself, present models or ideas and frameworks, but we present them very humbly. These are the 1.0 version. They're very rough because sometimes we still don't know those causal implications. So making sure you get those right tools and right models requires you to understand these cause and effect models, cause and effect reactions, to a good degree, right? That doesn't mean that not having the right models or not having the right tools or the perfect data or the perfect model should paralyze us from activity. Again, going back to the devil's argument against my first point, you can still make the right decisions. There are a lot of obvious low-lying fruit that we can do to make progress for a lot of these populations in these communities without having to get the most high fidelity, complex, accurate, representative model. But to get to those, we do need that type of localized data. And this is where communities come in. And Mihir's question is even better, right? It's not that they just provide the data as an input source, but how much do they own that process of incorporating that data into their own decision-making, planning, and tools? And this is where I have to admit that I need to do more of my research and work, and I would love to make some of my research go that way, is how do you now make those tools accessible and available for these? Anshu, you and I went after a grant recently looking at how we can take, imagery and artificial intelligence and have that as a process that communities in informal settlements can own, because they don't need to understand the complexity of machine learning and deep learning. But if they're providing the data and have the interface themselves, they maybe can have a way to get some of that information back to them that shows, look, here was that risk to flooding in your community, and here's where you might want to put certain resources, or you might want to plan an escape route, or might want to have raising of the certain homes, right? I don't think it needs to be that hard. Perhaps there needs to be some person or agency like Seeds India or so many other NGOs that plays the liaison role in some of those, that leverages some of that capacity that may not be there. But it goes back to that question we have in the humanitarian community, which is how many of these communities have the internal technical capacity? If it's not there, we can sometimes bring it and have it externally resourced, but a lot of times you can develop it internally, right? You can train, and that might be the things you want to do with some of these communities.
Oh, that sounds really exciting. Moving ahead, Chandrani Bandhopadhyay asks, how should the urban governance systems adapt to the changing context? And how do you leverage technology to inculcate resilience in this process? And I'm going to combine this with another one from John McGain, who's asking about, he's asking for a comment on sustainable outcomes with balanced socioeconomic and environmental parameters, how this is impossible in a society that is primarily measuring value in financial terms. So governance systems, we want to use technology, but currently we're just stuck with, one primary filter, which is financial. Ronak?
Yeah, I see them as almost two different questions, and one is related to the prior one, right? The decision making that takes more into account than economics. The leveraging good decision making with technology is it's not just a problem for these rapidly growing cities and informal settlements. I'll even tell you right now, I'm based in the state of California. Our benefit system, the system that we were going to use to help provide the social protection programs from the stimulus during the shutdown and lockdown, was so antiquated. It was built on a technology architecture that very few people even knew how to use well, and wasn't able to adapt fast enough to make sure that we were giving out these income support payments as rapidly as we needed. And so that's a big deficit if government programs are using a lot of this old technology that isn't meant to be that nimble and flexible and adaptive for the changing environments that we're facing and the uncertainties that we have, right? So that's a one thing, right? A lot of these government systems and processes need to have better technology. The second part of that question from the first person is that how does that then make sure that it's included in better decision making, and then goes to the economies and ecosystem question. And that's a harder one for me to answer, right? Again, it's this, how do you balance our economies with our ecosystems? And you can't do it if you don't have the ecosystems even there at the table. And right now, in those rooms where those decisions are being made, that's still not a part of that process. It's always a part of the process that comes after, or an advocacy organization brings in later, right? So again, this is probably a better question for someone who researches that type of governance and governance models within cities, but I would say that they're simply absent from the table.
And I think, you're right. These are two different dimensions, and we will take them forward. I think even within this series, we'll be talking a lot more about this. I think what what really strikes me is the way Chandrani puts her question, that it's around governance, right? And somewhere in our next webinar, when we'll be talking about the poor and the migrants and the bottom of the pyramid crash, then governance needs to go way beyond what currently we see as government and actions of the government. So I think there's a lot more over there, and I think David will add to this in the participation lens that he brings. And similarly, I think the question around the financial lens that we currently use, one way forward, and we may not all agree with that, but one way forward that some colleagues are finding is to try and monetize as many other intangibles as possible. And that's the impact modeling that we are seeing taking shape, very nascent stages right now, but I think coming times will be interesting to see how we are able to, without trying to push back on the financial filters, which are probably pretty strong, how do we work with them and create spaces within that to bring sustainability elements into it. uh, I move to the next question from Tricia Perdigon, asking what balance can we effect between land development and the decentralization of global resources in overpopulated and dense cities that have almost no space left in them. So land globalizing and
Ooh, I think
overpopulated.
this is a better question for you, Anshu. This is your bread and butter on urban
I have
planning.
no butter these days. Hardly getting any bread. Yeah.
So again, I would say I'm at a loss for this because it's hard. Again, and I'll retreat back to the fact that I have my certain silo of discipline, and again, I need to learn more of how these things factor into urban planning and development, and what kind of resources are taken into account. I've seen a lot of innovative things piecemeal on how you construct cities and lay them out, how you densify without making sure that you concentrate those risks and disease to hazards, right? A lot of my research is about how the current density, the numbers alone, are an impediment to public health and things like preventing pandemics. But there may be models and ways of doing that that aren't, right? And so there may be ways of densifying a city to make sure that footprint is reduced while protecting public health, but at the same time, even further from her question, reducing that ecologic impact. Now that's an entire discipline in itself that needs to be developed, right?
So let me share a quick anecdote before I move to the next question, which is also somewhat linked to this. So I'm not as much as you, but I do tiny bits of teaching and thinking at the School of Planning and Architecture here in Delhi. So last year I was working with the urban design department on a lab that they call the City Futures Lab. And without much thinking, I had designed a session where the question that I posed was, in the year 2100, what will our cities look like? And my whole run up to that was that when we talk of future planning, we talk about master plans with a 20-year horizon. We sometimes talk about vision documents which are 30 years ahead. So we are talking right now about 2050, but you don't see any planning documents that talk about 2100, in the urban context. You see a lot of the climate graphs that take you to 2100. And when you see those, you say, oh, that's really distant in the future, right? I like you, Ronak. I have a daughter who's 5 years old, and one day it struck me that in the year 2100 she's going to be 85 if all stays well with her, which is not too old, right? Especially for her generation. So she should be walking around and living on this earth. And here we are. We call ourselves planners, and we're not talking anything about 2100. So that's the question I posed. And there was one student, really bright, who came up and she said that in the year, so she drew it, and it was like a really green city with trees and parks, and there were elephants roaming around. And her argument was that in the future, we will not need to overpopulate and be dense because everything will just explode, and you could be so many trades will just be able to work from anywhere, which is something which has come and hit us and really come up in a big way during this lockdown. Work from home. We talk of digitizing our offices. Nothing and nobody, no board could drive digitizing an organization and the digital movement as much as COVID did. So I think it's very interesting times to see how we might be entering a future which looks nothing like what our past trends tell us. And I do hope there will be a silver lining and there will be some good surprises up there. With that, I move to the next question from Ashima Sapra, who's asking about a shift of focus investments. How do you shift your focus and investments to rural areas and smaller urban centers with better livelihood and infrastructure to help reduce this pressure on bigger urban centers and megacities? So, the same thing that, so there's two parts. There's one where a track is and technology is suddenly taking you in that direction on its own. But what can we do, and can your space, the health background, how can COVID-19 and what shifts this opportunities, allowing us to make, can there be a shift which takes us back to our villages and our roots, Ronak?
This is a bigger debate. I've had this with various colleagues, and it's hard. I'm not sure there is. I don't think that. I suspect that focusing on how we get back to more rural livelihoods, or at least rural living in smaller towns, is that viable at the moment, only because just the drive of urbanization is due to economic growth, and it's due to where the jobs are, right? People want to be in cities because there are tons of benefits to being in cities. There are tons of benefits to being in larger cities, right? From the cultural to the social networks, let alone the jobs, right? So in the US, at least, a lot of that approach has been, how do you make employers, job creators, or people that put these livelihoods out there, attracted to medium or smaller towns or cities, right? That way you can reduce the burden on the large cities. And time and again, it's hard, even for those types of employers to do, just because the talent a lot of times wants to be located in those dense cities. That's where people are, that's where their customer base is, and that's where they want to be as well. So it's hard to think about doing that, but it is critical, maybe not to the rural part, but at least the small towns and cities, right? The next wave of urbanization we're going to see, the growth is going to be in a lot of these secondary cities and secondary towns, where I think the idea of protecting these cities is less overwhelming, right? When you take on a place like Rio or Mumbai, it can seem so overwhelming to try to intervene in those types of cities. It's just the sizes, the magnitude, and the scale of the problems and the deficits in the infrastructure can be immense. But in a lot of these small towns and secondary cities that are still going to be growing, I think we're not behind the ball. So if we can implement a lot of these good practices and lessons learned there, that would be critical. Shifting our focus there may be, not that meaning we should ignore the Mumbais and the Rios, but that's where we can at least make sure we don't have these maladaptive forms of urbanization, right? Ones that at least produce public health systems that can protect the most vulnerable and create the kind of cities we want to live in, right?
So Ronak, just to update you, we have a total of about 120 comments. They're not all questions. There are quite a few questions that still remain to be covered, but there are also some very useful comments. And on the chat box is an internal discussion also happening. So it's really nice to see that some people are posting questions and others are commenting, and there are cross comments happening, which is something really nice that we must both go through once we are done with this webinar. But there's one which is, I think, very close to your heart. So let me talk about this. Kirti Dabas is asking, what are the challenges to adaptation of a One Health policy in developing countries? Is this a solution? And can you explain the concept through an example where it has been implemented? Ronak?
Oof, I can't come up with an example off the top of my head. This might be a good one for, we'll keep a note of this question so I can get back to it. It's hard. I mean, just from the US, I've seen various funding mechanisms towards One Health to integrate some of this. And specifically, it was one of those areas that when I talked about how bringing other disciplines has made me think about things. And we had a research meeting with veterinarians that talked to me about biodiversity and animal reservoirs for disease that, I had heard a little about, but I'd never made so many close links to public health and pandemics. But that's another, pathway. We've talked about 4 pathways of planetary health. What we didn't talk about was our increasing encroachment on these ecosystems has stressed a lot of these populations, animal populations specifically, with reduced biodiversity, and brought us in closer contact with a lot of these animal reservoirs for disease that we wouldn't normally have. The emerging diseases that we're seeing are a consequence of some of that biodiversity loss and our encroachment. So a One Health approach does need to take that. And I would say right now, I can't think of a good example because a lot of what I've only seen has been the first step, which is, can we do more surveillance and monitoring to make sure that we can ensure that we can track or catch the next emerging disease, rather than how do we prevent ourselves from doing that encroachment and biodiversity loss itself? And that seems to happen as a separate conversation of environmentalists or, ecology protection than the public health area. And those need to be brought together better.
Yeah. So now we are closing, we're about an hour from where we started, Ronak, an hour into this program. So I think what we'll do is let's take maybe one or two more questions. We are conscious of everybody's time in these times. And as you've said, all these questions and the comments are logged on this thread. And we will, for whatever we've not been able to cover in this conversation, we will be working through the thread. So you will hear from us, and we'll also think about it and learn from the discussion that's happening, which is, I think, really rich in the chat box. I'll take at least one more, Ronak. Nadia Dorota is talking about work from home, and which is more in the developed countries, but it is as a principle, getting applied everywhere much faster than we had thought it will. And this is going to lead to highly dense city populations overspilling into rural areas and smaller centers. So I think it's interesting that, this is a disease which the cities have brought to the countryside. And we'll talk about this later in the next webinar, but it's been a huge conversation that the poor are paying a price for the disease that the rich, brought in. So we flew it in on airplanes, and the migrants had to, walk the highways to deal with it. So she's asking about how can existing cities adapt to and prevent this overspill. So I think she's also implying that it's not just population, but a lot of our problems will move with us. Do you have any thoughts on that, Ronak, and especially from the health perspective?
Yeah, it's hard. It goes back to the similar arguments about, climate justice, right? The people that soak up these resources are, causing a lot of the disruptions that we're talking about and the risks that we're describing, but the people who bear the brunt of those consequences are often urban poor. Specifically during this pandemic, and even in my own communities, you can see that we've noticed that a lot of the vulnerable populations, minority populations, or low-income workers are often, just like you said, in the jobs where they're not able to work from home, right? Specifically, when you get down to essential workers, not just work from home or not work from home, a lot of our essential workers happen to be in that group as well. So if we are going to say that in the drive for protecting all of us, in the drive for flattening the curve, we still need to have essential work happen, and we still need to make sure that people that need to get to their jobs are able to safely, then the resources need to be there. The funding needs to be there to protect them. And that can take various forms, right? It can be types of social protection programs, it can be types of childcare. It can make sure that they are compensated for that type of work and kept safe when doing so. Again, though, it goes back to an issue of justice, right? It's no longer about, can we come up with the right ideas and the right tools and the right type of resources? I think we probably are able to come up with those even now. It's, are we ready to do that, right? Can we do that and make the argument that that needs to be done? And so I would love to see something come out of this that has a full breadth scope of how we have let a lot of the vulnerable populations bear the brunt of the consequences of this, while at the same time sacrificing them for a lot of the other health that we're trying to gain, right? Like I said in the beginning, you're allowed to die, you're not allowed to die of coronavirus, as long as you're in the wealthy, but if you're poor, you're allowed to die of anything else, right? And that just isn't fair.
Yeah, that hurts. So, Ronak, I have the perfect question to end this conversation with. And Zahir Hassan asks, what are the 3 actions you would recommend for reducing the impact of any future pandemics?
Wow. So even though I talked about the need for a lot more operational research or the idea of making more complex risk models for investment in limited resources, I have to go back to something that I often shouldn't say as a researcher, because I'm always looking for research funding, is that we know a lot of this. There is nothing new under the sun in terms of being able to protect populations or prevent these pandemics from having the impacts it has, right? It's not rocket science, right? There's I had a public health professor who would say that constantly, right? A lot of waterborne illness, which is the #2 killer of children worldwide, right? It's the greatest burden of disease for them after respiratory illnesses, is just about keeping clean water separate from your toilet water and sanitation, right? Having that infrastructure is critical. So there's some very basic things in just basic housing, basic water and sanitation infrastructure that would have immense broad impacts, not just on baseline public health, that would then let you be able to withstand other impacts like a coronavirus, right? Makes you healthier as a substrate, but also prevent the spread of future pandemics, right? Number two would be primary healthcare. And I'm not talking about very expensive first world, latest cancer treatments, but I'm just talking about basic primary care. To fund basic primary care across the globe is actually not that hard. It can be done with very easy models that provide a lot of those things, from surveillance of chronic diseases and management to vaccinations that would actually, again, have huge knock-on effects to make sure that we're protected from another pandemic. And lastly, both of those things would let us have the system of trusted communication and change makers within these communities that would then let us be able to adapt quickly and flexibly to a changing situation. So here's a virus, here are the critical things you need to know about it, here's how to keep you and yourself and your family safe, and here's the misinformation that's happening. Right now, I think there's been a lot of questioning from a lot of people, even my own family, who's educated and watches the news about what they should and shouldn't be doing and how much risk there is from the coronavirus, right? Here in California, in a developed country. So having those three things would help us a lot in terms of protecting us from the next pandemic, but go a far way to improving public health generally for vulnerable populations.
On that positive note, Ronak, although we could have gone on easily for another hour looking at the number of questions that are still queued up there, but alas, we want to respect everyone's busy schedule these days, and so I'm afraid we will have to bring this session to a close. The whole conversation has been recorded, and it will be available on this Facebook page, as well as it will be parked on a YouTube link for those who do not have access to Facebook at work. So if you have any friends you would like to share it with, please do so. And we will be following up. As we said, we will be back on this chat box. So apologies to those whose questions we could not take in this hour, but we will definitely take this conversation forward. I think it was a really nice and well spent hour, Ronak. I did enjoy it. It was an insightful, brief presentation that you made, but I think the Q&A was really rich. There's so much there's there for all of us to learn. And we found some new friends who posed some very good comments and questions. So this is not the end. We will, of course, find ways to stay in touch and take this forward. I've learned a lot. I've got a lot of questions about things that we still don't know, but it's a good thing to know what you don't know. And that's been a big win. With this, thanks to you, Ronak. And sincere thanks to the whole team at HHI. Aaron is with his headphones. He's making sure that this has run smoothly. Others have tried to, put together and push this out, which is why we have this lovely audience here today. The Seeds team has been supporting me. I could not have, sifted through these 120 odd questions and brought this to you. So thanks, guys. It's really valuable. We couldn't have done this without you. And thanks also to David Sanderson at UNSW and our friend Meg Keane at ANU. This is an outcome of weeks of conversations about how we can bring this to all of you and find people to talk with. It's a rich learning experience for us, and that's why we're here. So all boxes ticked. It's been a great evening, and over to you, Ronak.
Yeah, well, I'll just say thank you, Anshu, and everyone for attending. We were really humbled by the overwhelming interest you've shown, and we're learning a lot again, and we'll go through the chat box as we said. We hope this has been interesting and enjoyable for you. Thank you to everybody that supported this, Aaron and Katie at HHI. And let me remind you, you're going to be treated to an especially illuminating discussion by Dr. Sharma here on July 2nd at 10 p.m. Eastern. Make sure you get that timing right. It's July 2nd, 10 p.m. New York time, on the collapse of the informal economies in these low and middle income cities and what can be done to support a lot of these livelihoods. Also, I just wanted to mention that this entire webinar series is being done in run-up to the second Urban Resilience in Asia Pacific Conference occurring in Sydney, December 3rd and 4th, and it'll be moved to online if we have to. So you can find details and a link to that on this series webpage. Again, please join us for the next webinar in this series, Resilience at Risk, and have a great weekend. Bye.
Bye.